Before making his campaign stop in Savannah, Vice President Mike Pence was at the CDC telling officials there he expects FDA approval for new vaccines in mid-December. Doug Richards has more on that and also how the CDC is faring as the administration winds down during a historic public health crisis.
The vice president's visit to the CDC campus came as many backers of the CDC are, quite frankly, pumped to see the Trump administration go away next month.
We were there before. We've been there before.
Protesters geared up to meet the vice president's motorcade outside the CDC's main gate. They highlight the political contrasts over the last 8 months, with an administration that often stressed maintaining the economy more than it was willing to mandate restrictions to contain the pandemic. The administration's critics say that approach has cost lives.
It's not reversible. The question going forward, are we going to be able to mitigate some of that? Let's hope so.
The Trump administration has stressed development of a vaccine, which was the focus of Pence's visit. Officials say they expect the inoculation of nursing home residents and healthcare workers starting shortly after FDA approval in a few days.
Which we think is likely sometime the week of the 14th of December, that we could be shipping within the first 24 hours and we could be vaccinating people within 24 hours of that.
Pence predicted it would happen that quickly in all 50 states. Distribution of a vaccine will coincide with the change in administration in January. And backers of the CDC are hopeful that the agency can regain some of its lost morale and again recruit top healthcare workers once the transition is made to a Biden administration. Carlton Duncan worked at the CDC 35 years.
I think the future looks bright. I think that things are going to improve. The incoming administration clearly understands what has happened and what needs to be done.
Duncan says he hopes the CDC will put greater stress on ethnic diversity when it starts rehiring for positions that had been vacated over the last 4 years. That, he says, will also make the CDC stronger going forward.